Hey there, I'm Dayna Johnson, dental practice management expert, certified Dentrix trainer, and founder of Navoni, revolutionizing the dental industry through innovation and strategic leadership. It wasn't long ago that I lived in your shoes, navigating the daily challenges of managing a dental practice with the hopes and dreams of having a productive schedule, money in the bank, and getting home on time to my sweet daughter. After 25 years working in the dental practice and 17 years as a certified Dentrix trainer, I found my life's work, helping dental teams one-on-one, optimizing their systems and software. If you are looking to create the thriving dental practice you have always dreamed of and empower your high-performing dental team, you are in the right place. Let's get started.
Happy Hygienist Appreciation Month to all of you hygienists. What I've been doing for kind of this time of year is giving you, the hygienist, some tips and tricks on your specific workflow. And so in my last episode, we talked about production goals and a mix of services and how to calculate what your production goals should be. It probably wasn't a very popular topic, but a very necessary topic. And so you could go back and listen to that. I also gave you a worksheet, a calculator that Rachel Wall puts together. It's how to calculate what the percentage is that your practice is doing in perio services. Because a lot of times what I see is the office thinks that they're doing a lot in perio when they're really not. You know, the average in the US is more than 50% of Americans have some form of periodontal disease, but we're only producing 5 to 20% in perio services in our practices. And so I think it's really good for you it's an eye opener to see what your perio percentage is. So look back on that episode last week. Today, what I want to talk about is kind of your workflow, like kind of dive into your natural workflow. And the first thing that we typically do as a hygienist is when we sit the patient down in the dental chair is we review the health history. You know, that's one of the first things that we do during. And I want to talk about the health history because it's also one of the biggest pushbacks that I get from hygienists about, well, I just don't have time to go through the health history, or they didn't fill out the form, so I'm not going to go over it with them, or they're still filling it out on paper, or whatever that might be. So let's talk about how we can improve our efficiency for getting that health history review done with the patient during the hygiene visit. Because really, the health history review should take less than a minute. Really should. It shouldn't be long. It shouldn't take up. And it is one of the most critical, important pieces of the hygiene visit, or any dental visit for that matter. I could be talking to the dental assistants as well. But the hygienist is typically the one that is reviewing the health history more routinely than any other producer in the practice, because you're seeing the patient more often than any other provider in the practice. And so it's a regular part of your visit. And even though it should take the least amount of time, it's the most important piece, one of the most important pieces of the whole visit. Because when we look statistically at why doctors or hygienists are being sued or have litigation or being audited for records, is lack of health history information, documentation. That is the number one reason why a doctor will lose a lawsuit, is because of lack of health history documentation. So it's so critical. And the health history nowadays is just so streamlined because of how good our electronic forms have become. You know, when I was in a practice, of course, we had paper charts. We did everything on paper. And if you're still using paper, then you hand the patient a paper form, and the last thing they want to do is fill out a blank paper form to update their health history, especially if they've been coming to your practice for 20 years. It's like, don't you know me? I've been coming here for 20 years. And you hand them a blank health history form, and they hand it back to you with a bunch of scribbles on it. So it gets frustrating. People get frustrated with the health history because patients don't want to do it. You don't want to do it. And so it just gets left behind. And we can't allow that to happen. Nowadays, I remember when Dentrix first came out with the questionnaires, and it was probably close to 20 years ago, maybe 17 years, 15, 17 years ago. Dentrix came out with questionnaires. And I remember when they first came out with questionnaires, and I was on board. Like, I was on it. I wanted to eliminate paper. I wanted things to be more streamlined. And it was amazing how, accepting our patients were with the forms. They synced pretty well into the Dentrix system. And so now the electronic forms that we have available now are just incredible. They sync in health history, they sync in medications, they can update the emergency contact. So there's just so many good things that we can do with a really good electronic form. So that's like number one, is we really want to increase the adoption of electronic forms, especially for the health history. And most patients want to fill out forms. I think the statistic is 83%. This was a study that I read, and this study was probably 3 or 4 years ago. I haven't found a more recent study, but 83% of patients surveyed want to fill out electronic forms prior to their visit. And they also want that form to be somewhat filled in so that they don't have to fill in all of the information. And with a good electronic form that syncs into your Dentrix software, it should be recognizing what's already in your Dentrix health history module. So that's kind of where I'm going next, is really good electronic forms can really help streamline the process. The other piece to the health history is making sure that you are using the Dentrix health history module. Okay. You're not opening up the document center and looking in the document center for the most recent scanned in paper health history, or you're not, opening up the clinical note to find the health history documentation. That just slows you down. It breaks that workflow. It slows you down. It's inefficient. And so the Dentrix health history module was redesigned several years ago. I think 3 or 4 or 5 years. I can't even remember all the updates, but the Dentrix health history module was redesigned many years ago. It's just so good now. So you've got different sections. You have the medical conditions, you have the allergies, and you have the medications, the patient reported medications. And then the other thing that the health history module will show you is if you're using e-prescribe, it will also flood in any.
Did you know that you could increase your team's productivity by up to 200% if you had a formal team training program in place? And businesses that do have a formal team training program in place also enjoy up to a 24% increase in profit margin. If you want to learn how and book a call with me, click on the show notes and book a free discovery call with me, and we will talk all about it.
Medications that the patient is having done at like another pharmacy. So it'll also flood in all of these other medications that the patient might not even report to you. So that can be kind of cool as well. And then it also has a section for emergency contact, preferred pharmacy, and there's also a note box. And so then you can also attach pop-ups and things that are critical and non-critical. You can make notes, you can inactivate it. So the health history module now is just so comprehensive and so good. And that is where you want to be doing your health history review with the patient. So my recommendation, when the patient sits in the chair, if you have dual monitors, so if you have a monitor that is in patient view that you're using for x-rays, or you're showing treatment estimates or something on this monitor that is in patient view, I would then have the health history module, the Dentrix health history module, up on that second monitor so that you can review it with the patient. So the patient is physically looking at the Dentrix health history in their view. So you can show them, this is what I have on file for you for your medical conditions, your allergies, your medications. Because when the patient physically looks at it and is visual and seeing it, I mean, they might point to it and say, oh my gosh, I've never taken that. I haven't taken that medication in a couple of years. Wow, I can't believe you still have it listed here. And so then you will get a better review with the patient if they're actually looking at exactly what you're looking at. And then you can just inactivate that medication because the patient's not taking it anymore. You don't want to delete it because you want to keep it in their history, but you can inactivate it. And then they can see who their emergency contact is that you have listed in the system. And then you can update it right then and there with the patient sitting in the chair. And so then when you go to send the patient out a form, the form is probably filled out every 1 to 2 years. The health history review is done at every visit. So it's the health history module that you want to be doing in the chair with the patient at every visit. And then if you have a really good electronic forms system, it pulls data out of that health history module and it puts it onto the electronic form. So then when the patient is filling out the form, they can see what you already have on file. Okay, does that make sense? That's how it should work, because then that creates a more efficient, streamlined workflow between the form, which the patient fills out and signs, the electronic form, and the actual health history review that happens in the chair, in the dental chair. Now, some of you that are listening, you might not have dual monitors in your treatment rooms, okay? If you don't have a dual monitor in your treatment room, then what you could do is, I don't know how you're reviewing x-rays with the patient. Maybe they're turning around to look at a monitor, to look at their x-rays. I would just do it similar to how are you having patients review x-rays? If you can create a system similar to that for the health history so that they can actually see it, you will get better information when they're actually looking at it with you. And it's this conversation. My biggest pet peeve is, has there been any changes since your last visit? The patient every single time is going to say no changes. So if you just document no changes in your clinical note and the patient, you didn't even review anything with the patient, that is not a health history review. Okay. That is, what would I say? That is, just not a health history review. That's unacceptable in my opinion, because that is not good documentation. If you ask the patient, has there been any changes in your health since the last time you were here? And the patient says no changes, and all you do is document no changes, that is not a health history review. Okay? That is unacceptable documentation. That will if you get audited or you get called for records, or the patient has some kind of a medical issue and you didn't document it, then you're going to be liable. So we don't want that to happen. We want you to be better clinicians. All right. You are oral health physicians. You are part of the educational process in the dental practice. So I want you to do a better job. All right. So let's just kind of review a little bit. Let me know what electronic forms system you're using now and if it's not working very well. Okay. So, or if you're not using electronic forms yet, then let's talk. Schedule a call with me and let's talk about how we could move you into an electronic health history form now so that we can streamline the process for you. And patients aren't filling out paper forms in the waiting room and making you late every day. That's the first thing is what electronic form system are you using? Is it working well? Or do we need to implement one from scratch? And I can help you with any of that. Number 2 is, as a hygienist, using the health history module at every visit should be your review process. Okay, so we want to be able to, the best option is to pull that health history module over to the patient-facing monitor, just like you would x-rays. That would be ideal. If you don't have a dual monitor in your treatment room, then however you're having patients review x-rays, I would do that for the health history as well. That way the patient can visually see what you have on file. Okay, my friends, I hope this has helped. Please reach out to me. My link is in the show notes if you want to schedule a discovery call with me to see how we might be able to work together and I could help you with some of these systems. My calendar link is in the show notes here. And then let's chat. All right. I hope this has been helpful. I hope you have a great rest of your day. And I look forward to watching your journey of becoming a high-performing dental team.